Okay, so I'm gonna try and make a video while I'm driving. Maybe not the best plan, but I don't really have any time. So, excuse my mess of a truck. I basically have been living in it for the last month, 3 weeks, working all the time. Anyway. So today is November 6th, I think. Thursday the 6th. Tomorrow will be, I think, my 9th shot. Tuesday, November 4th was 2 months on testosterone. As far as changes, I notice my voice is deeper. Other people notice my voice is deeper. I have had to shave my face twice. I didn't necessarily have to shave my face, but I had like these 6 hairs here and 6 hairs here that were long and black. So I went ahead and shaved them, and then my mustache was kind of getting a little darker, which, like I've said 100 times, I've had for a long time. But so I've kind of shaved twice. I know it's No Shave November, but I'm not really cool with the 6 little straggly hairs here. That's not really the style that I'm going for, the look that I'm going for. So maybe once I have some more, maybe next November, we'll see. So I've been doing my shot on my own since last time I went to my class. I go to my class again today, so for a month now. Like tomorrow will be 5 shots, I think, that I've done on my own. So I want to talk about that a little bit, I guess, because I think that at first I was really, like, one of my biggest fears, like, I have 2 fears: spiders and needles. So giving myself a shot was really, like, just not even in my scope of, like, what I was able to do. So I kind of felt badly about that. I kind of felt like if this was so important to me, like if taking testosterone and outwardly becoming, looking more masculine, if that was all so important to me, like, I should be able to do the shot. Like, I should be able to do it on my own. I shouldn't have to have anybody do it. Like, it was like a bad feeling that I had about myself, about not being able to do it. Not bad enough that I did it, but so I guess, I don't know, has anybody else felt that way? Is that normal? I don't know. It's how I felt. But then after my last class, I talked with a couple of the ladies in my class, and they kind of told me, like, when they do their shots, they just think about that like the way that it was explained to me was like doing the shot womanhood, like. So I kind of thought about it that way, and I kind of mentally got over that hurdle of giving myself the shot. So the first time I was super excited. It took me, like, the biggest thing for me was to not sit and think about how I was going to give myself a shot. I just had to do it. And I know that's so much easier said than done, but that's literally what I did, because the weeks prior to that, I had worked it up to so much and, like, thought for so long about giving myself the shot that by the time I was actually maybe ready to do it, I had really worked it up to so much in my mind that I couldn't do it. So the first time that I did it, what I really did was I got the shot ready. I didn't think about giving myself the shot or anything like that while I was getting ready. I just got it ready. I went and sat down. A friend of mine suggested, he says that he, like, listens to Pandora music and then does his shot or whatever, so it's kind of relaxing. So I turned on Pandora. Like, I just went and sat down in my room, and I basically just, like, picked a spot and stabbed myself. And it was, I mean, it's not, I always say that, like, it's not really like stabbing yourself with, like, a knife or something. It's just a little tiny needle. But it doesn't seem like a tiny needle when you're trying to give yourself the shot. So I just did it, and I was like, oh shit, I just stabbed myself with a needle. And so I went ahead and injected it, and then I was done, and I was super proud and super excited about getting it done. And then the weeks after that, I basically have just done the same thing. As long as I don't think too much about it and I just kind of do it, it's not bad. I had a little bit of an issue the second week that I did it in the first week I did it in my right leg, the second week I did it in my left leg, which is kind of awkward because I'm right-handed. So I was kind of reaching over myself, and it was just kind of an awkward thing. And it almost felt like I could feel the needle going through the layers of my muscle and tissue on my leg. Well, probably some fat there too, I'm sure. And it kind of, I don't know, it was almost like a popping type feeling. I don't really know how to explain it. It kind of hurt, not like excruciating pain, but it did kind of hurt a little. So I talked with my buddy about that, and he said that he only ever does it in his right leg, and he just kind of moves around places, I think, and that it's a lot easier and less painful for him to do it always in his right leg. So I've been doing it just in my right leg since then. I haven't had that issue happen again. I don't know if maybe it was just the angle that I was going in at or what with that, but so I've done it in my right leg since then. I try and move around so to not be going into the same exact spot and cause scar tissue. So yeah, I've been doing my shots. They've been going pretty well. I go to the doctor next Wednesday, so hopefully then he'll kind of up my dose. Maybe I can start to see some more changes. Some people have said maybe my jawline is changing. I don't really see it. I mean, I do see something is different, but I don't necessarily think it's my jawline. I think it has a lot to do with the angle that I take a picture. Like depending on where you're looking, I don't know that it looks any different. So I don't know. Something is changing. I do have more hair on my stomach, which is really lightly coming in, like around my happy trail, like on both sides of my happy trail, which I've always already had. So there's that. Lots of people, like at my work and my family, like in the last 2 weeks probably, have been mindful of saying he. My office assistant, she has started saying he, and that's kind of a tricky thing because we deal with another office out of Chicago. I'm in Indianapolis, they're in Chicago, so I don't really know them on a personal level, just over the phone. And my office assistant has been saying he in reference to me to them, which I think may be a little awkward, I guess, because they're like, what? They've known me for a long time, and she has always been the pronoun that's been used. So now I think they're probably going, why are you saying he? But my office assistant says she doesn't care. She'll do whatever I ask her to do as far as respecting my wishes on that. So yeah, I mean, people I've known for because of I've worked for my company for such a long time, and my parents before me have worked here, and blah blah blah. So I've known some of these people since I was 12 years old. I'm 28, so even like one of the people in my company, who I call him like my uncle, he just found out last week, and he came into the office and he was like, hey bud, blah blah blah, which for him was his way of like acknowledging and accepting or whatever. So that's pretty cool to have, his support and other people like him trying to change pronouns. For a little while there, I was getting a little not disappointed, but just, it's a difficult place to be in for you to feel one way and for you to not even know how to navigate in the world with the way that you feel inside, like, because you're not necessarily perceived how you feel. So it's a difficult thing to navigate in a world where you're not perceived how you feel, which I think we all feel that way. But I totally lost why I was saying that. Like, driving and doing this is not a good idea. But yeah, so I don't know, it's weird feeling like a male, like a man internally, and then maybe sometimes passing, and then all these other people who have viewed you as a female for a long time, and then you trying to figure out how to be viewed as and act as a male when you've not been brought up that way. So I don't know if any of that makes sense. I kind of probably just really rambled. But yeah, I mean, at least people are making progress with me, and I'm making progress, and so that's good. I mean, that feels good. That it's better for my mental well-being. My girlfriend has also, not necessarily, I haven't heard her say he in reference to me, but she does just say Randy in place of saying she. So she's definitely putting forth that effort. I have seen her, like she's shown me like her Facebook or something, and in text she has referred to me as he or him. So I mean, that's good. I don't really know what she says when she's talking about me when I'm not around, but she seems to be making an effort, which is great, because I know that it was a very difficult thing for her to kind of grasp and understand. So that's good. I don't know. I think I have a lot more that I want to talk about, but this video is already 11 and a half minutes, so I'll probably cut it short here. But I did schedule my top surgery January 27th with Dr. Garramone. I will make another video at some point and kind of go over that. Hopefully I can do that before I have the surgery. My experience so far with him has been really good. His office has been very helpful. The process is pretty straightforward, as far as what it says on his website and then what actually happens. So that's all been pretty good. So yeah, that's what I've got. Sorry it took so long to make this video. I will try to not wait so long to make another. Okay, see you later, bye.